A CDC advisory committee is expected to decide today if it is safe for states to resume use of the Johnson & Johnson one-dose coronavirus vaccine. Health officials ordered a pause last week to investigate a potential link between the vaccine and a rare but serious type of blood clot. Out of the 7 million people who received the shot, only a handful have reported symptoms, but at least 2 women have died from those blood clots. Joining us now is Dr. William Schaffner. He is a professor of preventive medicine and health policy at the Vanderbilt University School of Medicine. Dr. Schaffner, welcome. Great to have you with us. So the CDC met last week to discuss the J&J vaccine, but concluded it needed more information. What kind of additional information were they looking for, and what do you think we can expect from today's meeting?
Well, Tanya, good to be with you. I'm on a break from that meeting, and I'm pleased to tell you that the meeting is proceeding very, very well. We're having good discussions. The committee was looking for more complete information. Were there other cases out there that had not yet been discovered? And what about the age distribution and the sex distribution of these cases? Did they occur all in Caucasian people? Were people of color also affected? With another week and a half of work, more information has come in that's basically reinforced what we learned last week. Those data have just been presented, and that policy discussion is about to begin.
That's good to know. So in terms of doctors and patients, what symptoms do they need to be looking for so that they can treat these clots if they present themselves as quickly as possible?
Yeah, this is very important. All the cases so far, with one exception, have occurred in women, and the vast majority of these women, 13 out of 15, were less than 50 years of age, so relatively younger women. The symptoms begin at the end of the first week and into the second week after vaccination. So this is very important. You know, for a day or two after vaccination, you can kind of feel crummy and maybe have a little bit of a headache. That doesn't count. These symptoms begin at the end of that first week. And the symptoms we would be concerned about are persistent severe headache, abdominal pain, swelling in your legs, and certainly shortness of breath. That should all be brought immediately to medical attention. And please let your doctor know that you received the J&J vaccine and when you received it.
That's good to know. Dr. Schaffner, do you yourself feel comfortable with the J&J vaccine? Would you, recommend your patients take it?
The J&J vaccine, Tanya, has some really big advantages, and that's why it was so popular. It's one and done. It only requires one dose. And of course, people who are concerned about side effects quickly figured out, well, that's only half the side effects. Also, since it can be maintained in normal refrigerator temperatures, it can be taken out to patients that are otherwise hard to reach, the homeless, the homebound, for example, people with disabilities so they can't leave home. It can be taken to the inner cities and to rural areas. And so health departments were very excited about this vaccine because they could bring it out. And in that context, I'm very excited about it. I think we'll be able to continue to use this vaccine. We'll see what kind of restrictions the CDC's committee places on it by the end of this afternoon. But I think we'll see it continue to be used, certainly in select populations.
Of course, and of course we'll have to wait, till the CDC comes out with those recommendations. But in terms of the subset of the group, as you pointed out, that has suffered the worst side effects, which are very, very few people, but you said they all are women within a certain age range. Were there other similarities that those patients had that you might say, well, look, if you're a woman between this age and you have X, Y, and Z, maybe take another vaccine?
Well, it's remarkable. The X, Y, and Z was looked into, and there's otherwise no common denominator. So this needle in a haystack kind of event was detected nonetheless by our excellent vaccine safety monitoring system. And of course, it was immediately investigated. We've had emergency meetings of the advisory committee, and we're dealing with it. This should give us all confidence that we have an excellent vaccine safety monitoring system underway. I'll tell you, it's the best in the world.
It certainly seems to be. All right, so Dr. Moderna announced today that it hopes to have a COVID vaccine booster against variants approved by late summer or early fall. What more do you know about this booster? How does it work? And, is Pfizer also announcing a booster as well?
Well, clearly we all know about these variants that are out there. They're like cousins of the parent virus. They are somewhat different. The most common variant comes from Britain. Our current vaccines work very well against that variant, but there are others. And if those others become more common, they can evade at least some of the protection we currently have with the vaccines we use now. So boosters have been worked on. Moderna is there. Pfizer's working on a booster. If we need it down the road, maybe like influenza vaccine, right? We have to get a flu shot every year. We may have to, down the road, get our COVID vaccine at some interval, maybe annually also.
All right, so that could be a new schedule on Americans' calendars, the COVID-19 booster vaccine, the world we live in. So let's go back to the CDC for a moment. The agency is considering new guidance on mask wearing outside for people who've been fully vaccinated. What can you tell us about that? And do you think the science is there to support us finally ditching those masks when we're outside in the open air?
Well, Tanya, that's actually the most common question I get now. I've been vaccinated. Can I go outside to the ball game, be in the park, be with friends, and not have to wear the mask? People want a reward for having been vaccinated. After all, they tell me I'm 95% protected. Can I do some things now that I couldn't just a few weeks ago? And I think the science is there. I hope my friends at the CDC revise those guidelines so many more people who are vaccinated can get out and about and enjoy the summer and be able to take off their masks. That would be a terrific reward and give everybody a feeling of we're really making progress in fighting this epidemic. But let me put in a last plug for getting vaccinated. We still have lots of people who haven't been vaccinated. We have ample vaccine supplies in the refrigerator. They're not moving into arms. If you haven't been vaccinated, please show up, roll up your sleeve, and get vaccinated. The vaccines are safe and powerfully effective.
Great advice, and I know it's a huge feeling of relief now that I'm vaccinated. It feels like, there's a weight off of my shoulders. Well, Dr. William Schaffner, thank you so much for joining us. We appreciate it.
My great pleasure. Thank you.